And Cynthia, the Premier is changing his tune when it comes to testing for COVID-19 in this province. What was he saying today?
Well, Janella, he certainly is. He came out swinging today, admitting Ontario has not been testing enough people for COVID-19. In fact, the province has the lowest testing rate per capita of any province in this country, half of Quebec's numbers, for example. The Premier promised that is going to change immediately.
No, my patience have run thin, and no more excuses. It's unacceptable. We have the capacity now. Before, I understand, we didn't have the reagent. We didn't have all the testing. We have the testing capabilities. We have the assessment centers capabilities. We have the reagent. We say we can do 13,000 a day. Then we need to start doing 13,000 every single day.
There has been a growing chorus of criticism about Ontario's low testing numbers. Even though the province was able to increase lab testing capacity to 13,000 a day, the number of tests actually was dropping. Only 2,500 yesterday and a little over 3,000 today. The Premier says he wants testing increased to the maximum 13,000 a day, but this doesn't answer a critical question. What went wrong?
You've been asked about this many times by myself and other reporters over the last few days and weeks. Where has the failing been? Why has Ontario had the lowest rate in the country? What has the failure been?
Well, what the barrier was prior was the reagent. Again, Cynthia, I'm not going to look in the past. We're going to learn from the past mistakes, and we're going to move forward. And I know moving forward, that testing is going to be ramped up. Again, no more excuses. It's unacceptable. I agree with you 100%.
But Premier, to follow up on that, every province had the same challenge of getting reagent and setting up assessment clinics. We're the ones who have come out on the bottom there. How is that possible?
Well, I've been following the advice from our Chief Medical Officer. I've been taking that. I think he's been doing a great job, but we need to increase testing.
Now, I'm told by a Ministry of Health spokesperson that new testing guidelines will be announced on Friday. And we know from countries like South Korea, the more testing, the better to combat COVID-19. Now, seeing as our testing rate is so low, it's important to look at hospitalizations to get a sense of what else is happening in the province. Take a look at the numbers. 2 days ago, there were 523 people in hospital. Today, there are 605. And 2 days ago, there were 200 in ICU. Today, there are 246. But it's important to note the province's modeling released last week projected in a best-case scenario there would be about 800 people in intensive care by now. I asked Ontario's Chief Medical Officer of Health if the projections need to be revised.
I think you raise a very good point, and I know in talking, they say they're optimistic about re-looking at it with the data and may give a better forecast in the future. So again, they said we will be looking at the data, we will be assessing that and changing the projections accordingly.
The Chief Medical Officer of Health says the numbers seem to be coming down, but he wants it sustained, not a temporary drop. As for when isolation restrictions might be lifted, well, he says it's being looked at, but the dial has to be turned back very carefully so the virus doesn't flare back up.